8:49 now. We've got today's trends of 2013. Expected to be a big year when it comes to technology, especially in areas like transportation and medicine. Tech expert Katie Linendahl is the creator of the blog TalkNerdyToMe.net. Still my favorite blog. Katie, good morning. Nice to see you. This one here helps doctors and nurses find the vein when they want to take blood.
So very traumatizing for anybody that goes in and they actually can't find the vein. This is a Christie VeinViewer using DLP technology, and as you can see quickly, now hospitals are reporting they can find the vein on the first try.
Especially when you've got a young patient. I've had that with my daughter where they couldn't find the vein.
Poking them with a needle, no problem here with the Christie VeinViewer.
Okay.
A local hospital has new technology that uses light to see veins through your skin. North Hills Hospital is using a vein viewing technology that makes needle sticks for blood drawing and starting IVs easier than ever and less painful, especially for patients with small and hard to find veins. The infrared light, a digital video camera, and an imaging processing unit projects images of a patient's veins onto the skin surface.
The vein finder helps with rolling veins. It also helps with cut sticks in half by about 50%. So it totally increases our patient satisfaction and helps a patient in any circumstance.
The VeinViewer is portable, so any patient in the hospital can use it.
Well, if you're a little squeamish about needles, stay with us. You may want to listen up for this one.
You got one shot to get it right? A device being used right now at one hospital in Howard County eliminates the poking and the guesswork to make getting an IV a little easier. ABC 2 News' Catherine Hawley got to check out the gadget today.
At Howard County General Hospital.
Hi. How are you, Lexi?
The pediatric emergency department treats nearly 18,000 children every year.
Look. Big girl.
Like most toddlers, Lexi isn't a fan of being poked and prodded by the nurses. But sometimes children don't have a choice.
Children's veins can be really hard to find.
It's been a little easier for Hagen and her coworkers the last 2 months.
Hi, big girl. Let me see. Let's see that arm.
The green light is definitely attention grabbing, but this VeinViewer is pinpointing exactly where the blood vessels are.
A lot of times we rely on feel. It gives us a better visual. It can reduce anxiety in patients. As a parent, you can be more confident in the nurse that's doing the procedure.
It kind of looks like an X-ray, but the technology actually uses near-infrared light to show what's under the patient's skin. It's non-invasive, and the image is projected right where the veins are.
The image helps hospital staff find the vein faster and eliminates multiple sticks.
If they had something like this for Amanda, you know, it would have made her 30 sticks a lot less painful emotionally and physically.
Michelle Kupiak is talking about her daughter Amanda. She was in and out of Howard County General for 6 years, dealing with serious infections, surgeries, and severe scoliosis. But it was that medical treatment that led her to discover her passion.
My husband and myself and my family supported helping her, you know, get better, and her mind and body. So she started baking, and we found out she had a real talent for it.
Fast forward to 2009, and the family opens Cupcakes and Company in Elk Ridge. But they wanted to give back, and Amanda wanted to help the hospital. So for the last 5 years, they've been raising money at their annual Cupcakes with Santa event.
We've now, as a total, have raised $9,000 for the hospital.
$9 grand they used to buy this VeinViewer machine.
Want to look at this one? Big girl.
This was like the perfect piece of equipment to give back to the hospital.
Catherine Hawley, ABC 2 News.
Well, the VeinViewer is currently being used at Howard County General Hospital in the pediatric emergency room and in preoperative areas.
Hate being poked and prodded when doctors are searching for your veins? Well, patients at Citizens Medical Center can now rest easy because that's a thing of the past. Carlos Villalobos explains.
We call it Christy. Is Christy going to help you, honey? And I said, oh, yes.
Meet Christy, or its real name, the VeinViewer.
But you can see right there, there's the veins. You know, so if we're going to do an IV and we couldn't, you know, we couldn't feel the vein or we couldn't
see it real well if his skin was real dark or real thick or anything like that.
The VeinViewer is a device that projects a visual roadmap to the patient's vessels on the skin. As the newest addition to Citizens Medical Center, and the only place you can find it, it's been a big hit with both patients and nurses.
Prevents the patient from having a lot of IV sticks and infection, and so that way they can get their cure done a lot better and quicker without having any difficulty when we have this VeinViewer.
Hospital officials say it reduces the number of sticks and the time it takes to start an IV by 50%. As you can see, you can much more clearly see my veins, which makes it easier for the nurses to stick a vein. This makes the experience much more comfortable for the patients.
More or less, they're happiest to get the IV in as soon as possible, to not be stuck. You know, I mean, if you can get it done in the first try, the first attempt, then they're happy. You know, if they're happy, then we're happy. Get it done, and of course, they can get patient care and effective treatment as soon as possible.
There's 3 VeinViewers at Citizens, and nurses say because it's more efficient, they try to use it as often as possible. At Citizens Medical Center, Carlos Villalobos, your hometown news.
Well, getting an IV placed or having blood drawn can be a nerve-wracking experience for some people.
But coming up after the break in tonight's Health Watch, how one Sioux City ER is hoping to change that with help from technology.
The staff at Unity Health St. Luke's emergency room, they have a new handy piece of equipment. It is called a VeinViewer, and it uses infrared light to let doctors and nurses look under the skin and find a vein for blood draws or IV placement.
We have a lot of kiddos here, and kids are they have a lot more fat tissue underneath, and it makes it really hard to see their teeny tiny veins. So this equipment helps to make things easier to find and hopefully less traumatic for the child.
Much on the top.
The new device is designed for use in patients young and old, or anyone with a fear of needles.
I would say our equipment gets used daily. We've been able to bring this equipment in immediately and get access, and they just can't believe how wonderful it is that we no longer have to try 2 or 3 attempts because their child came in quite sick.
It was purchased for St. Luke's by the Children's Miracle Network.